Hey guys, Jimmy Yen here, the acupuncture guy with Achieve Integrative Health, and today is another post of our daily power tips. So today's Thursday, and we're gonna change it up a little. To Thursday, we're gonna add an extra treatment day during the week. So instead of just discussing treatments on Tuesday, we're gonna discuss treatments also on Thursday. And so today's topic is specifically answering the question from Lucy. So Lucy, thank you for suggesting all of those great topics, and one by one I'm going to go through every single one of those topics, okay? And so thank you for sending that to us. So if anybody else has any other topics that they want me to discuss, feel free to sign a message below or private message me. Either way, I'm going to address every single one of them. Now, just because I'm addressing every single one of them does not mean I have great success in treating all of them, okay? So, but I'm gonna go over what I would do, what I have done, and maybe I've just treated a small number of cases in certain situations. I'll let you know what I've done in the past, or if I haven't treated any of those specific disorders or ailments that you want me to address, then I will, tell you what I would do and what I would suggest as for at-home care, self-care that you can do at home, okay? So today we're going to talk about the first thing, which is sarcoidosis. Sarcoidosis. So this is one of the disorders that Lucy wanted me to talk about. And so, gotta be honest here, I haven't treated a ton of these cases, maybe less than 10. Success rate, not very high, because I haven't treated it a lot, right? Versus like any type of neurological conditions, I've treated thousands. Those I'm very confident in what I can do. But sarcoidosis, I am not confident in the sense of having, because I haven't treated enough to get a very, a system to get great results. So, but let's first talk about what is sarcoidosis. So you can Google this. Obviously, I just Googled it, and I just wrote down the Mayo Clinic's definition. So basically, it's a growth of tiny collections of inflammatory cells, granulomas, and it can happen in any part of your body, but let me get out of the way so you can read this. It can happen in any part of your body, but most commonly in your lungs or your lymph nodes. So basically, we are immune cells or our fighter cells, we have troops all over in our body, and these troops decide to have a party, and they just get together and they're having a party, and they want that party to never end, so they just stay together, okay? And so that's what's happening. These granulomas, they're having a party, staying together. They don't want to go home, so stay there, and then they make their new home in that area. And a lot of times that's in our lungs and in our lymph nodes. And when you have a party, sometimes there's some beer, there's some alcohol, there's fast food, there's some junk food. What happens? You generate a lot of waste, right? And that waste makes the party even bigger, in the sense that, okay, you have a group of people that are partying and they're generating about this waste, but if they live there for a long time, the waste keeps on accumulating, and the party gets bigger and bigger and bigger. It might even attract other partiers, right? And so that's the same thing what's happening in the sarcoidosis. When our immune cells get together, they form a granuloma, and it can cause other inflammation. So if it gets in your lungs, think about it. What can it do? It's going to affect your ability to breathe, right? If it gets in your lymph nodes, it's going to affect your ability to fight infections, right? So what can we do about it, right? So in Western medicine, again, you can look this up. It's called Google, okay? The treatments is anti-inflammatory medications, or even medications to suppress the immune system. They're using like the anti-malarial medication that's escaping my mind, but it's one that they're using for COVID. But basically the principle is it lowers your immune system. So from the Western medicine standpoint, it's anti-inflammatories, or things that drop your immune system, because first of all, nobody knows what's the cause of it. They think it's a genetic, some virus, your body has some virus infections, latent virus infections, bacteria infections, fungus, whatever. People don't know, okay? And so they think there's a theory, it's a theory, so it's not a fact, there's a theory that there might be an autoimmune component. That's why they use these immune suppressant medications to lower it, okay? So, but what can we do? What can we do naturally, okay? So anti-inflammatory is a must. The fact that things clump together is going to generate inflammation. Like I said, you come to a party, you're going to generate waste. You got to get rid of that waste, okay? So you got to do some anti-inflammatory. So one of the things that I would recommend is, let me write this in reg. Let's do an anti-inflammatory diet, okay? You can do, some of these are also called elimination diets. So you want to start from there. Make sure we're not retaining waste to make these, our immune cells clump together, right? So let's go on an anti-inflammatory diet and let's do some anti-inflammatory at-home therapies that you can do. A lot of foods can have that anti-inflammatory effect. So like in Chinese medicine, we know we use like ginger root, part of it as cooking, right? There's curcumin, right? There's actually a lot of the vegetables are anti-inflammatory. So if you go towards more of a vegetable-based diet, you're going to have that anti-inflammatory effects and the alkaline effects to reduce that acidity in your body, right? So anything, also, we're talking about supplements. Some common supplements, very powerful supplements, are, fish oil. Fish oil is common. People are not thinking, it's not as effective anymore. Fish oil is one of the best anti-inflammatory supplements on the market, but you have to get the right quality, okay? I'm not going to talk about supplements, how to find the right supplements. We can do another video about that. But you have to get the best quality, strong quality, pharmaceutical grade, third-party tested, and if you don't, it's not going to work. So fish oil is very good. Alpha lipoic acid is also very good. I actually just recently found that there's an R alpha lipoic acid that's actually more readily absorbable and it's actually going to be better. So alpha lipoic acid, very good. Curcumin does work. I haven't seen it be more effective than omega-3s. The omega-3s work the best, so that's something that I do. So anti-inflammatory, right? And in Chinese medicine, we don't talk about suppressing the immune system. If you have an autoimmune disease, you don't suppress your immune system because that leaves you susceptible. It's just like, okay, your country has, let's say the U.S. has, invaders. We have people that are constantly attacking the U.S., and the worst thing we can do is remove our troops, right? The worst thing we can do is say, hey, we don't need troops, so let's take away our troops. Let's just let all these invaders come in, right? That's what happens when you suppress your immune system. In Chinese medicine, we actually say something different. We say the word balance. Balance your immune system. You want to boost your immune system to create more balance, right? And the misconception is that if you stimulate your immune system, that it will trigger more of the autoimmune response. That's not the case. We treat a lot of Hashimoto's and we can restore the balance in their immune system and from the blood labs, reverse that by boosting the immune system. Yes, it's kind of counterintuitive to what the mainstream is teaching us, but in Chinese medicine, we actually boost the immune system to balance the immune system. What does that mean? We feed our troops. We make sure our troops are fed, because when your troops are not being fed, they're going to be delirious. They're not going to, they have a gun, and they're not going to know, they see somebody walking across the street. They don't know if that's foreign or a host, right? If they're an enemy, if they're a friend, or they're an enemy, right? But if you feed them, then they have the ability to think, then they can decipher who is really the enemy and who is not an enemy, right? So really, you feed your troops so that they can function better. Same thing for your immune system. You feed your immune system, boost your immune system so it can be better, right? And also a benefit of Chinese medicine is, so Lucy was concerned about the granulomas. How do we shrink these granulomas, right? I have not been effective in shrinking granulomas 100%. What I can tell you, I can prevent them from getting larger and causing other problems. And so Chinese herbal medicine is huge, very effective in doing this. And this is based on me using for other tumors or growths herbs to keep those tumors from going from like fibroids, cysts from getting bigger, Chinese herbs is very effective. I cannot say that we can shrink it 100%. I'm not saying that. I'm just saying that we can prevent it from getting worse and causing symptoms, okay? So Chinese herbs is very good for granulomas. Sometimes these at-home therapies, they're not strong enough, okay? Supplements, over-the-counter supplements are just not strong enough. So you do need some help with the Chinese medicine, okay? So that's what I have done with the small cases that I've had. Again, I am not an expert in this. I'm just letting you know with the small cases that I've had, what I have done. The success rate was low for me. It's mainly because I haven't had enough. I haven't treated thousands to know what works the best. But this is what I would do. I would start with an anti-inflammatory diet, do some anti-inflammatory supplements, and also use Chinese herbs and acupuncture. Acupuncture can move those supplements, move those nutrition to the troops. Remember, we got to feed the troops. Okay, feed the troops so they can stop partying and go home, or feed the troops so that they, can identify who is foreign and who is not foreign. All right, guys. So, Lucy, I hope this was somewhat helpful. I'm sorry this is probably not the answer you wanted, but I wanted to address it. I don't want to ignore any comments that people give me. I want to basically make sure I answer all the questions, even if I'm not the expert. But this is what I would do. Let me know. Give it a try. See if it helps. Let's work on this together. All right, guys. So today is another Treatment Thursday. We're going to turn Thursdays into treatments. If you have any questions like Lucy, or if you want me to talk about any topic specifically, make sure you post below. I will come back to it and I will go through every single topic. All right, guys. Jimmy Yen from Achieve Integrative Health. Share this post, and remember, everything in life is achievable.